All right, so today we have Dr. Izabella Wentz. She is a best-selling author and really an international expert on all things thyroid and now adrenal gland. Well, I think probably always adrenal gland, but now just putting more information out there specifically on the adrenal gland. So I'm so glad to have you here, Dr. Wentz. I know that I'll just be honest. When you first started following me on Instagram, I felt like a little kid because my colleague, he's a physician. He shared your information with me back in like 2019. And that was kind of like a big kickstart for me in my functional medicine journey of just kind of figuring out like, what is this thyroid stuff? What is this adrenal gland stuff? Like, why are so many women struggling? And so I have to really give you a lot of credit because I went through that Hashimoto's protocol book and it was just like, man, this stuff, it makes so much sense. It's very practical. It's very useful. And I just love your approach on giving solutions rather than just talking about problems all the time. So I'm just kind of interested, how did you get to this point in your career with your story to where you became the expert that you are on thyroid stuff?
Oh, it's such a good question. I guess I just was frustrated with people not getting the help that they needed. Initially, it just started with myself being this Hashimoto's guinea pig, right? Because I was given medications, and while I was excited to take them, they didn't really do much for me. I went from sleeping like 11 hours to 10 hours and being slightly less cold, right?
Sure.
And I was like, okay, what can I do to make myself feel better? And once I started peeling back the layers of Hashimoto's, I finally, felt like myself again, felt human for the first time in a long time. And I wanted to get the information out there because I knew there were other people that were going through a similar struggle as myself. And I ended up working with people just to try to help them to get to a better place because there wasn't a lot of information out back 10 years ago.
Yeah. So that was 10 years ago. I was going to ask you when that was because, in I think the time frame here in the medical world, 10 years is not that long. Like there's a kind of a generational cycle of information. And once it's in one generation, it takes some time for that new generation to kind of come up and start to actually utilize that information to help people. So I'm kind of interested, what kind of, as a pharmacist, like what kind of backlash do you feel like you were facing just in the conventional medical world? Because there's a lot of misconceptions out there, even still, about the thyroid. So how have you seen that change? And have you seen enough of a change to where you can say that we're making real progress?
Initially, I was working in public health and I was just, I was fearful of losing my job about coming out with this non-drug approach to thyroid health. So I just try to be very careful and try to cite as much research as I possibly could. And so my first book, The Hashimoto's Thyroiditis, is just heavily based in research and citations and every little bit of research that I could find just to sort of prove my point. And I remember when I first started, people were saying on Facebook, I had a Facebook page up and I was sharing some of these methods and people were saying, why on earth would you go gluten-free? You do not have celiac disease when you have Hashimoto's. Or people would say, why would you need this supplement? Or diet has nothing to do with the thyroid. And, I started my thyroid pharmacist website in 2013 and my social media presence then. And I now say last year, I was so excited to see a continuing education module for pharmacists. And it was on Hashimoto's and subclinical hypothyroidism. And they quoted my book and they talked about the gluten-free diet. And I'm finding and I'm meeting so many people these days where their endocrinologists will tell them about the gluten-free diet or they'll talk about various supplements that they can utilize. I think we still have a long way to go. My goal would be for every single person that's diagnosed with Hashimoto's to be able to go to any doctor, or any practitioner, any kind of nurse, health coach, and just get that same message of, hey, you've got Hashimoto's. Here are 5 to 10 things to look into. This is going to be, I want it to be common knowledge, just as, maybe exercise is good for you, right?
Mm-hmm. Yeah. And I think that really does have to be the approach because as soon as that is common knowledge and people we're on the same page about it and we're seeing that, hey, this is no longer a talking point. This is something that has been proven time and time again to be beneficial for most people. Now we can kind of get on to the more difficult things and more challenging things that it often persists with any kind of autoimmunity and kind of hypothyroidism condition, because I think people get very discouraged when like they go to their doctor and they're told, hey, like this is all you can do, right? Like there's this medication, or maybe try cutting out gluten, and they're like, well, what else? You know, like what else can I do? Like they're looking for ways to become empowered. So do you feel like, and I know you're really awesome at this stuff too. You have awesome protocols and great resources for people. Tell me a little bit about how you've kind of seen progress with real people just implementing these solutions that you talk about in your books and in your protocols and in your programs. Like what kind of progress are you actually seeing?
My background before I became the thyroid pharmacist was that I was working in public health, and I had a bit of training in outcomes research and to, really look at the statistics of, was a change helpful? Was a change an actual improvement, and how do you track that? So I started utilizing that with my clients, people within my programs, as well as just my readers, just trying to do some qualitative surveys with them and asking them questions. Hey, I told you to try this supplement. Did it actually help you? Hey, I told you to try this dietary approach. Did that help? And so over the last decade, I've collected, I would say, thousands and thousands of these answers from actual real life people. And they've given me some of the things that really do help. So the gluten-free diet, about 88% of people feel better gluten-free. Maybe not 100%, but we're trying to figure out, everybody's a little bit different. We're trying to figure out what their triggers and causes are. 80% of people will feel better on a dairy-free diet. So I know that there's our different schools of thought about dairy. There are some types of dairy that may be beneficial, especially if you've only been exposed to organic grass-fed dairy your whole life. Maybe you might just do fine with it. But in people with Hashimoto's, many times of them, they do tend to react even to like the best kind of dairy products. And so these are some of the very common patterns, gluten and dairy.
Yeah. And I think again, there's this pushback a little bit because you have different camps that are pushing different viewpoints. And again, there are a lot of different benefits to following, whether it's a carnivore diet or it's a ketogenic diet or it's an anti-inflammatory Mediterranean, whatever it is. I think there's a common theme there that there are triggers, like there are individual sensitivities that people can develop, that can cause this molecular mimicry effect, right? That can start to trigger specifically the thyroid and other systems. And so I think it, no matter what you do, like you're describing, like you're going to see probably progress with going gluten-free and dairy-free, because there's oftentimes you're usually being more intentional, right? Like you're just saying like, hey, I'm going to pay attention to what I'm eating. And when you start paying attention, you start to notice like when I cut this thing out, I feel different and I feel better. And maybe if I cut it out for four weeks or so, I start feeling even better than I did before. And so I think people, when they start to realize that they have some empowerment with like, they have a say in how they feel, that really can spur them on in the right direction. So do you feel like with medications, because this is something that I feel like this is where I really want to get your perspective. How often or how likely do you think it is for somebody to get off of, let's say, Synthroid, levothyroxine, if they have been on it for a few years? Is that something that you've seen has happened quite a bit in your program, or is that something that you feel like is a good goal?
I would say generally my first goal with people is to get them symptom-free and to get them to really truly thrive. And however we can get there, whether that's through medication, meditation, whatever kind of modalities, I'm happy to support people and meet them where they're at. Another big goal of mine is to reduce inflammation in people's bodies. And at some point, especially if they're in the early stages of Hashimoto's, or perhaps the triggers are uncovered, they don't have a lot of damage to their thyroid gland, then they're more likely to recover their thyroid function. I would say the population that I see it most frequently in is postpartum thyroiditis or postpartum Hashimoto's. Those are generally the patients that are going to get turned around rather much more quickly. I don't know if it's fetal cells and the thyroid helping to heal the thyroid. There are different schools of thought about that, but that's been my experience is people with celiac disease and postpartum thyroiditis tend to be the more common ones that will actually have a return of thyroid function without needing to be on thyroid meds.
So in terms of different types of thyroid medication then, And I know that your whole goal is to get people like to talk more about the natural holistic solutions, which is what my goal is always as well. But I just think it's helpful for people to kind of understand, like, okay, if I do have to be on medication, what kind of medication should I be on? And one thing that I've found very interesting, and it's been one of my more controversial videos, I guess you could say, is looking at the ingredients of synthroid and levothyroxine, and how a lot of the ingredients in there may actually potentially trigger a worsening of your thyroid condition. Now, I don't know if that's been studied, but we do know that dairy and things like gluten and corn syrup and all those cornstarch, things like that, are not great for you. So what would you say are some alternative options that you feel like could be dosed predictably and would be a good option for hypothyroid clients or patients?
I really like Tyrosint. It's a T4 containing medication, but it's in a gel cap format, and it's got very clean, minimal ingredients. And so this one has been studied to just not be impacted by food. If you have H. pylori, if you have low stomach acid, if you're chugging your coffee along with your thyroid meds, these are all things that can cause interference with your thyroid medication absorption. The coffee effect could be up to 4.5 hours after the fact, right? We typically tell people wait an hour before having coffee or taking various 2 hours between taking calcium supplements and so on and so forth. There's a lot of restrictions on how to properly take your thyroid meds. And so Tyrosint, it was really quite peculiar. It was an Italian pharmaceutical company that came up with it, and they had this problem to solve of these like espresso loving Italians that were just, having their thyroid meds with their coffee, and they were not well controlled on their thyroid hormones. And lo and behold, they created this gel cap formulation, and all these happy Italians were able to have their espresso with their thyroid meds, right?
That's amazing.
This is a great option for people. I know when I was postpartum and I was waking up with my baby, like I would like crawl to the coffee machine and chug my coffee. So I was like, okay, let's see if I can get another medication, right?
Yeah, for sure. Board. Yeah.
And then people that tend to, they're on thyroid meds and they're still kind of having residual symptoms. Maybe they've got the hair loss or the brain fog, or they're just not quite feeling like themselves. There's T3 containing medications. Probably my favorite one is Armour. It's naturally derived. It's an old school medication, and it smells kind of funky because it comes from the thyroid glands of animals, but it does give you that the active thyroid hormone, which is known as T3. And a lot of people tend to say, I switched from Synthroid, Levoxyl to Armour, and I feel so much better. And that's another one of my favorites. And then there's compounded meds, and then there's T3 you can take as a standalone supplement. Some years ago, we had a larger variety of medications, but a lot of them have been either recalled or on back order. So these are sort of the main ones we're working with these days.
That's awesome. So I guess moving forward, now we're focusing more on the adrenal gland, right? And I think, as I said, kind of the entry point of this conversation, those two are never really separated, right? But there's this adrenal transformation protocol book that you've put out. What made you want or feel like you needed to specifically address the adrenal gland? Like, what was it about your research or your conversations with people that you're like, I need to do this? Like, what was that?
I think my clients a lot of times guide what I'm going to do. Like if there's a client that just didn't get better with the regular things I was recommending, or they had reasons not to take some of my recommendations, then I try to get creative and think of alternatives. And I also had a personal journey with my adrenals crashing after becoming a new mom.
Sure.
The traditional adrenal protocols are amazing at getting people better, but they are a little bit extreme. So I know I would say when I was like a dog mom, I would say you could sleep for 12 hours a day for 30 days. And then that will recover your health, right? And I mean, that's not realistic I'm sure, with your children at home, I don't know how you'd be able to do that, right?
Yeah, not at all. Yeah.
You'd have to leave for 30 days, which your wife might not be happy with.
Well, then that'll make her situation worse. So that would not work out well for anybody. Yeah.
Exactly. So, that wasn't really realistic. And then some of my clients, there's alternative ways to balance adrenals, which would be hormones. So you can do like pregnenolone and DHEA, and that can work really well. But then some of my clients who had like history of breast cancer or family history of breast cancer, or were breastfeeding or had other reasons where they didn't feel comfortable on hormones, I was like, well, we can't do that. And, you know, and I ended up being one of those people that was like, okay, I have a new baby and my adrenals are flatlined. And what can I really do? Like, what are some other methods I can support my body to feel normal and to feel human and to be the best mom, human wife that I can be, despite not being able to sleep 12 hours a night, despite not being able to decommit from everything in my life and take a bunch of hormones. And so I came up with this adrenal protocols, and then they worked really well for me. So I ended up creating a program for clients, sharing the same methods, and people were getting so much better in a much faster time period than some of the old school protocols that I had been trained in. And so I was like, well, maybe this might be something that I can just share with people. It's very lifestyle based, and maybe it can help others that are in that same situation of not being able to take hormones or sleep 12 hours a night or quit coffee.
Right. Yep. Yeah. I think the coffee thing is a big one. And that's something that my clients are always like, do I have to, cause I'm a huge coffee snob personally. And I drink it all the time, not all the time, but daily. And, I think for me, at least it's just having some understanding of like, what are women going through? Cause I work primarily with women, and it's not by choice. Like, it is by choice now, but it wasn't by choice back when I started this, because it was just, there were so many women that were coming into my office that were like having problems, right? That were having pain and fatigue and just were not feeling themselves. And I think you hit the nail on the head, like being realistic with people and saying like, hey, this is where you are. And we have to appreciate the fact that your body is protecting you to a certain extent. And we have to work with your body and adjusting these lifestyle factors, because taking a hormone or taking a supplement or taking even a medication is only going to be addressing one aspect of what's wrong, right? And it can potentially sometimes cause masking of other things as well. And so I feel like when we start to look at energy, which is really what I think the HPA access is destined to do, is to help us manage energy. And when we have that issue with managing it on our own with inflammation or high glycemic index diets, or we're insulin resistant, or we're not sleeping, full of caffeine, like what do we expect? You know, like we have to be really realistic with that. So what are some of like the top lifestyle tweaks that you feel like you make with people that have, you know, maybe not even supplemental, but just like day-to-day circadian rhythm kind of stuff that you feel like helps the most?
I think one of the things that sounds very basic, but it's actually very helpful, is like you said, the circadian rhythm work. So having that bright light exposure first thing in the morning. When I lived in California, I would just like open up my door and get the sunshine in, or in Boulder. Right now it's like very rainy and cloudy in Texas. So I have a daylight simulator lamp, or you can have a blue light therapy, or something that tells your body through your eyes that it's time to wake up and be bright-eyed and bushy-tailed, right? Because if we're just exposed to our indoor light, it's not enough to really trigger that response in our brain that it's wakey time. And then throughout the day, having that light exposure, so going for a walk outside, or perhaps just opening up the door and peering outside. And obviously, you know, if you're in a colder climate, then using the light therapy boxes can help. And then after dark, you know, we're like the freak house on our block, because we have red lights that turn on with the sunset, right? You don't have to be that extreme, but you could wear red light glasses, turn off your screens. Some people have candlelight throughout the house. And just to really be mindful of, like, are you sending your body the signals of when to have lots of energy, bright lights, versus when to not have lots of energy, and when to produce melatonin? And that would be darkness or red light. And those are just, people are like, oh, that's never going to work. That's so basic. And then they try it. And they're like, oh, wait, I hate to tell you this, but you were right.
It's like, people hate being wrong all the time. But I think again, it gets back to that frustration of like, how could it have been that simple, you know? And it's not always that simple, but there are components of it to where I think that's the hardest egg I have to crack with my clients, is like when I tell them like, hey, this is what we're going to do. We're going to structure your day in this way, like coffee after you eat, all those kind of things, get the light in your eyes. They're like, okay, like what else? And I'm like, that's a good place to start. And our goal, and for me anyway, my clients, I always like them to try to wake up before an alarm clock. I want them to wake up naturally if possible and not have to rely on that jarring stimulus of an alarm. And they always kind of laugh at me. They're like, I'm never going to be able to wake up without an alarm clock. I'm like, well, you can if your circadian rhythm is balanced. Like you can start seeing that on a more routine basis. And they always just laugh. Like a few days later, they're like, I can't believe it worked, but it's working. Like, and I feel so much better. And it's like, well, yeah, like you're working with your hormones, and like your hormones are fluctuating throughout the day. But I think, again, there's just this lack of this focus on lifestyle and lack of focus on empowerment of patients. And I don't know, the battle I face, and I'm not sure where you are, but since I'm not a physician, people often take what I say with like, they're not all that serious about it. They're like, well, if it was truly gospel what you're saying, it would be in the literature and it would be supported in conventional medicine and in medical schools and all that stuff. And so they have a hard time believing it. But I think we have to kind of keep pushing the envelope to challenge that generational wisdom that's being passed down through the literature, to say, hey, like these things make a big difference, and we need to kind of get away a little bit from a pill for every ill mentality. And I think as soon as we can do that through pages like yours and pages like mine, and all these other wonderful pages that are out there now that are pushing sometimes good information, sometimes not so good, and you have to be careful with woo-woo and some quackery out there here and there. But I think all in all, that the general consensus is pushing us towards hopefully closer to truth with information. But as you said too, it's also hard because it's not always written in stone. Like there is some wiggle room with each individual patient that you have to take into consideration. But I'm really happy to see that you're pushing the envelope, like you're moving it forward. And it's so cool to see it coming from a pharmacist too, is like the one that was trained in drugs, but you've gone this other direction and you've complemented drugs with lifestyle. And I think that's the best way of doing it in an integrative approach. So is functional medicine, is that kind of what you would claim to be trained in? Or you were kind of doing functional medicine before functional medicine was really cool. So like, what would you kind of call yourself to this point? I'm just kind of curious.
Identity crisis over here. So
yeah.
I was trained as a pharmacist, and I love medications. I think they all have, not all of them, but there are some medications that are the good, the bad, and the ugly, and they have their time and place. But I've also become really passionate about lifestyle medicine and the root cause approach. When I first started, I just was going on PubMed and trying various things and going into patient forums. And then I sort of found out about functional medicine, and I was like, this actually root cause medicine. This really kind of aligns with what I think medicine should be like, when you actually look for the reason why something's happening rather than giving people Band-Aids. So I think functional medicine would be I think that would be the best fit for me. Although I don't necessarily like to be in any boxes, right?
Yeah, I think that's a good place to be in. Now, what are kind of like, what is your overarching big goal? Obviously, you got the books, you got some programs, you work with clients one-on-one. Is that true? You work with clients one-on-one? I don't know it for sure, actually.
Occasionally I do. I have, the way that I like to support people is I have a lot of free content on my website. So I write really deep root cause articles on how to overcome various things. I try to break it down every week. I'll have a new article over at Thyroid Pharmacist. And then I have books that I've written that are available for low cost. And then I have programs as well as supplements. I try to help people in any way that I can, but also my time is a bit limited these days because I am a parent as well.
Sure.
So I do occasionally work with people one-on-one, but really my goal is to educate people about how they could take charge of their own health, so they can take my book or take an article that I've written, or maybe a social media post, I don't know, and
Sure.
just say like, this is actually something that I need to look into, and for them to be able to perhaps find a local practitioner to work with. And, a lot of the things that I talk about, they can actually be done without a practitioner. So you might have the best doctor in the world telling you what you need to do, but if you don't do those things, you're not going to get better. And a lot of the things do depend on people. So changing your diet, changing your lifestyle routine. I think some supplements are generally safe to be taken without supervision. And of course, working with a practitioner can really bring that together for a person. I know when I worked in public health, we used to train people on diabetes self-management, and the outcomes were so much better for people that were empowered and trained on how to manage their diabetes and worked with a practitioner versus people who just worked with a practitioner, no matter how good the practitioner was. So my goal is to always empower and educate people, and hopefully they'll be able to find a supportive practitioner for themselves as well.
Yeah. Again, you just hit on so many things that were bringing ideas to my head. But the biggest thing I kept thinking about was just how if people don't know what to expect, or they don't know really what they're looking for or shooting for when it comes to working through something, as soon as they hit a rough patch in the road, it's like most people kind of lose that confidence that maybe they're doing the right thing still. And so I do think that as much as I give out as much free information as I can, but I still realize that implementation of that is the hardest part, and implementing is a very difficult part. So I think what you have done though in your protocols, if you, number one, your case studies and your stories and your reviews, like that really helps people to have confidence that like, wow, like this stuff actually does work. It's worked for these people. They seem similar to me. I feel like I can also do this as well. I'm going to try it. But I think if people don't have that guidance and they kind of lose that confidence, it really can cause some anxiety and kind of cause this analysis paralysis where they end up doing nothing. And that's probably worse off than anything. And so I feel like moving clients forward is really great. Using health coaches or using practitioners of whatever kind is awesome. And I think that's where, again, things like social media has been so instrumental in just pushing knowledge forward much faster than I think it ever has. Because it gets challenged, it gets tested pretty quick. As soon as somebody puts something out there, we're like, is that real or is that true? I'm going to go search this a lot more, and we kind of figure out what the truth is. But I think for patients and clients, what I've noticed is there's just a lot of uncertainty. So how do you feel like you can help to provide some certainty so somebody who's listening to this podcast and they're like, I have hypothyroidism, I want to overcome my Hashimoto's. Like, how could you help to ensure that they can be more confident that this is going to be a better approach for them if they go through the lifestyle approach?
I would say for themselves to really check in with their own bodies. What I typically have people do is they have a symptom questionnaire, and they'll start rating their symptoms before they get started with the protocol. And as they move through it, I have them follow that along and really try to create a journal and document their successes, just to really see for themselves. Because sometimes it's hard to connect an intervention to whether it's helping you or not. I know I've had people that have been on 20 different medications or 20 different supplements, and I'm like, well, are you feeling better? And they're like, I don't know. I can't really tell which is doing what, right?
Sure.
And so one of my goals is to really empower people to have that kind of intuitive feedback from their bodies and to be able to understand what their bodies are telling them. And part of that is through tracking your symptoms. And maybe there's 10 things your practitioner wants you to do, or 10 things you read about that can help Hashimoto's. Start with one of them and do it for 3 to 5 days and see how you do before you jump in and try to do it all at once. Start them and build them into your habits. Otherwise, I feel like it can just be too overwhelming for people to know what's working, what's not working, and to even get started.
Sure. What are some symptoms that you feel like you would expect to improve fairly quickly by kind of going through a protocol like yours? Like, what are some things that you typically see right off the bat in that first 3 to 4 weeks?
So let's say my adrenal transformation protocol, which is really focused on circadian rhythm work and getting better sleep, just a lot of de-stressing, and we focus on blood sugar balance and the ABCs like adaptogens, B vitamins, vitamin C, some mitochondrial support and magnesium, very kind of foundational things.
Sure.
Generally within 2 to 3 weeks, we'll start seeing improvements. The brain fog, that goes away very, very quickly. I find carnitine really works well for that. It's a mitochondrial nutrient. And then the other symptoms, anxiety can get better really, really quickly, especially if you're balancing your blood sugar. The morning fatigue really does well with that circadian rhythm work. Magnesium oftentimes helps the issues like the anxiety and pain and trouble sleeping. Circadian rhythm work also helps with trouble sleeping. And libido, people will say that improves very well. generally about more than 80% of people will see improvements in those parameters within the 3 to 4 weeks, which I think is awesome, because sometimes I've had people months and months and months where we're doing various tests, and I give them an adrenal test kit and then they take it home, and 3 months later they're like, oh, it's still at my house, right?
Yeah, someone's packaging. Yeah.
Yeah, and then they can just people can overthink it, and practitioners can overthink it. And, you can just get started on doing some of these things that aren't too challenging to incorporate, and then you'll start seeing improvements.
Yeah. You brought up testing. This is another interesting conversation, but at least for me, testing was a high priority in the early days. And the more I did this with people and the more practice I got, the less testing I've done. I still feel it's a valuable tool, but I just found, kind of like what you were saying, it's like there's so much work to be done initially that's obvious, that can save a lot of money. And sometimes I always get back to this level of conviction that a particular client has about what they can do to feel better. And so I spend a lot of time talking about those things and reinforcing, how it's possible and why it matters. But testing still plays a role. And so do you feel like, what are some tests that you or do you use testing, or do you feel like it's valuable, or where are you at with that?
I love testing. When I test myself, my husband, my child, when I had a dog, I was doing functional testing on him whenever possible.
You were a dog mom, weren't you? Yeah.
Absolutely. But but I know it's not realistic for everybody. So there's barriers to testing. So some of the tests, they're like $700-800.
Mm-hmm.
Right. And then, you get the person to get the test, and then it might sit at their house because they might be tricky to do. I know I have a SIBO test from like 3 years ago that I never took somewhere around my house. Right.
Mm-hmm.
They're just tricky to get them done sometimes. And then there's like the test results, like by the time you get them, were they like accurate? Could you have done something about it? And so I say, generally for people kind of just coming to me, I would work them through some protocols. Now, if they didn't get better on those protocols, and they had the budget for it and they had the desire for it, I would definitely be open to ordering any test that I possibly can for them. There are those people that are like, okay, well, I'm not going to give up gluten. I need to see it on a test, right?
Mm-hmm.
Show me the reason why you think I have this. And so I'm very open to, if you want to do testing, we absolutely can do testing. Sure. At the same time, if you don't have the budget for it, I would rather you spend, $200 on a massage and a few quality supplements that'll hold you over for the next 6 weeks than to do an adrenal test, right? I already can tell you that you're tired.
Right.
I don't need an adrenal test to show me that. Over the years, when I looked at I used to do a lot of testing when I first started working with clients, and then I could sort of look at the patterns they were having, and like I would have a client tell me what was going on with them, and then I would like draw their adrenal tests in my head. And, I would say most of the time they were just correct, right? Sometimes with like gut infections, that can be tricky. So I might recommend testing for that, just because there might be different protocols for various types of gut issues.
Sure.
That said, I have like a gut protocol that's pretty comprehensive, right? So that can cover SIBO, that can cover a lot of the different protozoa, that can cover dysbiosis, and that can cover a lot of histamine and salicylate, all of those issues. So again, I'm open to either or, but I will say it just really depends on that person. Like ideally, like I would love to have somebody that would have like every single test done, and it would be so interesting and cool for me. Probably not for the client or patient, right? Most of them just want to feel better.
Yeah. Yeah. I think that's where like the nerd out of all of us comes out, because it's like, we want to see the numbers, we want to see the data. And again, that's very useful. It's very helpful, but I think you're right. If it's not being followed up with actual implementation on the fundamentals, the foundational pieces, it's kind of like what use is it in getting that data if you're not going to do anything with it? And especially again, if you're going to a practitioner who doesn't really know how to read it or what to do with that information, it's even worse, because then it creates more frustration for the patient. So,
absolutely.
What would you say? Getting back to the adrenal gland and thyroid, what would you say is because I just feel like we're seeing a worsening of autoimmunity. We're seeing a worsening of thyroid issues, especially amongst women. What is your take on why that's happening from your perspective?
I have this theory, the safety theory, and that essentially is that our body is continuously adapting to our environment. So sort of like a adaptive physiology type of way where our body is sensing danger, whether that danger is coming from watching the news or a bear chasing us or whatnot. All of that can lead us to essentially go into this state of survival. And, you know, when we think about what's useful for survival, it's generally not being super fertile. It's not growing hair. It's not having a ton of energy, right? For survival purposes, you generally want to be storing more fats, and you generally want to be, you know, kind of laid back in your cave, right? We have these lovely cave woman genes that haven't really adapted to the perceived threats of our day-to-day environment. And so I personally believe it's just our bodies reacting to all of the perceived stress that we have. And it could be from our processed foods. So our body's saying, okay, you're in a famine. You're eating this thing and I don't recognize this as food, right? Or it could be from watching super scary shows on TV where your body doesn't know that you know, the serial killer is on television, not inside of your house, right? So there's all of these different sources of stress that we might be experiencing, and that sends the body into more of a survival mode. And I think initially it starts with more reverse T3 being produced, and then potentially can lead into more of a thyroid situation where the person might have an autoimmune attack against their thyroid. Reverse T3 is essentially the thyroid hormone that blocks thyroid receptors. So rather than telling us to go, it tells us to stop.
Yeah, I think, and we see that too with, you know, sometimes with DHEA, and we can see the contrast with cortisol and DHEA and how that can kind of put a brake on your adrenal glands by design, right? It's not a faulty mechanism. It's by design most times. And so I think for women specifically, that's been kind of my area of focus, because it's culturally, you look at, you know, women were typically caregivers, right? Homemakers taking care of the house. And now we've shifted into where they've added additional roles where they're also contributing financially. And you guys they got all these added responsibilities to your plate, right? And I think that shift has happened in addition to the processed food and more inflammation and, you know, more even just social media exposure to information that maybe shouldn't be in our heads all the time. And I think that complicates things. But how would you communicate with a woman who's a mom, who is working, who is trying to provide, you know, good food for her family and take care of things and make sure the ship is running? Like, how do you kind of like just simplify things for that particular individual and say like, hey, like, let's start with these few things. Like, what would those few things look like for you if you're talking to that kind of person?
I guess it would depend on what stage she is in motherhood. So if she's got like a toddler, you know, I would say, take your toddler outside as much as you can. Make yourself some adrenal shakes, right? Do that on the weekends whenever that's possible. And if you have a child that's more in school and you're trying to keep the balance and working, then definitely the time that your child is in school, figuring out a way that you can get some things done. Perhaps if you are working and if you have a good enough income, hire a mother's helper or somebody that can come over and help you out with food prep or meal prep. That can be a very big game changer. I know I grew up in Poland and we used to live in community, right? So I would have my grandmother, my aunts, my cousins. We all lived very close to one another. And when my mom was at work, my grandmother or my aunts were taking care of me or helping her around the house, and, you know, vice versa. So right now we don't live in these communities in the United States. I wish we did. I'd love to start a mommune, right?
Sure.
But you have to create those, you have to kind of create your village. And if you are somebody that's working and making a good income, I would invest in somebody to help you clean the house or organize things, or just, you know, just clean up the toys once a week,
Sure.
you know?
Yeah.
And then maybe you can take some time off and get a massage instead of constantly cleaning or doing stuff around the house.
Yeah, that was huge for my wife and I. We kind of started to see some writing on the wall with her. We have 3 kids under the age of 6, and
Aww.
that third child, our daughter, she was tricky. Like, she was a lot of wear and tear on my wife, and me too, but definitely more on her. And when we moved to Tulsa and we bought a farm and we started investing in some different things, we started noticing that, her energy was just getting kind of low. And so one thing that we implemented was just a Friday morning for her, so where she can go do what she wants. She often plays tennis, which it's kind of a relaxing, calming thing for her. It's not too strenuous, but it's really done wonders for her and her hormones and just getting her mindset right and just kind of giving a break. Because I think and this is just speaking from a husband's perspective, I think we've kind of lost. I don't think husbands are involved enough in the health of their wife. And I think that's a problem long term, because we start missing the signs of early warning signs as things are starting to happen. Like, we start, associating a short temper with just like, well, she must just be, have that time of the month, or we kind of just have these beliefs that are not necessarily correct. And I think long term it starts to slide. And, as the spouse is experiencing more and more stress and more difficulty, it becomes like this big snowball effect. And so I think for I've been trying to encourage the spouses of my clients to really be involved in their wife's healing, and like really be a part of it, and talking about food and talking about where they're going to spend their money on. And is it appropriate to spend money on a cleaner, like you said, and have somebody come and prep and have somebody watch the kids every once in a while, instead of going out to restaurants all the time and spending your money there? Like, there's a lot of ways you can kind of put your money in different places that are going to be beneficial for your wife and for your family ultimately. Because really what I think the mother and the woman is in the household is like, you guys are typically the logistics experts. Like, your guys are the one that are executing most things that happen within the family and the family environment. And again, I think the husband is like, well, if I just provide financially, that's all I have to do, and then I'm good. And it's like, well, there's so much more than just finances. And even if you are providing equally, like, there has to be an equal share in how you're kind of raising the children and who's taking shifts and doing all that kind of stuff. And so I think that's really a really wise word from you just to say that, because I don't know that I've heard your conversations on that quite yet. Maybe you've talked about it a lot, but I feel like that is equally as important as supplements and testing and everything else that we talk about, is just making sure that on a day-to-day basis, there is a healthy environment that promotes healing. And I think if we can get that going, people will start to see resolution of their symptoms more and more frequently. So I'm really glad that you said that.
Yeah, absolutely. And I feel like, unfortunately, I see a lot of moms that will complain about their husbands, and they'll say, I want my husband to help out more. But sometimes the husbands, they're working 60, 70 hours a week. And that can be tricky too, right? Or if they have very demanding jobs, or, of course the women do. And sometimes it's like, you might both be really squeezed way too hard. And at that point, if you can get that lovely high school student that just loves to hug babies, like, please have her over, right?
Yeah, they're not that expensive.
Let her save up for what are those, Stanley Cup, right? Let her buy her own Stanley Cup.
Is that what the kids want these days, is a Stanley Cup?
I think so.
Yeah.
I think I heard that.
Yeah. No, I think you're right. I think it's for my wife and I, it was really just having the conversation of being like, okay, like, what do we want for the future? Like, what are we working towards? And then kind of taking some steps backwards to kind of get that result was most instrumental for us. But I think a lot of people we don't have the conversation. So we kind of just keep existing and we kind of keep going with the flow. But that flow will take you not great places sometimes. And I feel like, again, being intentional and having these conversations is sometimes more than enough to springboard families in the right direction. Because really what this is about, in my opinion, is the family. Like, if we can promote family health through the husband, through the spouse, through the spouses, through the grandparents, like through the whole top to bottom, like, it really can create generational changes in kind of causing a ripple effect in our society when it comes to health. Because health has gotten to get to the point where, we're seeing generational weakening happening, where we're seeing diabetes hit earlier, metabolic syndrome hitting earlier, and autoimmunity spiking in children. And I think we have to start at, how can we get the family healthier? And so I think you're doing an excellent work in that. And again, I really do appreciate you giving all your wonderful wisdom and advice. It's been super helpful for me in my career. And hopefully people that are listening to this podcast will find a lot of benefit from it. But do you have anything else you want to add as we kind of wrap up here?
Thank you so much for having me. It's been such a pleasure. Thank you for the work that you're doing out in the world. And thank you for helping so many women get their spark back and get their life back.
Sure, absolutely. And I'll put all your links down into the caption down below for everyone who wants to get your books, your protocols, all your awesome stuff. And definitely follow you on social media. And yeah, I appreciate you again, and we'll talk down the road.
Sounds good.
All right, so that's just going to stop. And I think it's uploading. And so I think we have to stay on the, I think we may have to stay on the call until it's finished uploading, but I could be incorrect.